Thank you, ladies and gentlemen, for tuning in to Eye on the Community. I'm your host, Sean Anthony. Joining me up next is Dr. Anahi Ortiz talking about Opioid Alliance in Ohio. Dr. Ortiz, welcome to Eye on the Community. How are you today?
Good. It's a good day outside today, and thank you so much for highlighting this issue.
Absolutely. You know, July is Minority Mental Health Awareness Month, and this opioid epidemic is hitting our minority populations extremely hard. And what would you say to those communities that are having such a hard time with this issue?
Sure. I think especially in the minority population, one of the biggest issues is stigma, is almost shame, and folks really don't want to face it, and they don't want others to see that they have this illness. And so I think one of the first things people need to know is that addiction is a disease, just like having high blood pressure and diabetes is a disease. This is a disease, and there's nothing shameful about it. There is bodily reasons why you have this addiction. That's number one, is understanding it. And number two is you don't have to shout it out to the rooftops or anything. Seeking treatment for this illness, for this disease, can be as private as go to your doctor, make an appointment with your doctor and say, hey, I'm having some problems with this, can you help me? And maybe they can help hook you up with a treatment center. The other is there are phone numbers and there are websites that you can privately call or go to seek treatment, and everything is private, everything is confidential. It's up to you whether you want others to know. The other is NetCare is a crisis center. They have a crisis center and they have private lines for crisis, and it can be a crisis, and you can call that number and you can talk to someone about what's going on.
Dr. Anahi, I have a side question. How
Sure.
would a person know if they have an addiction problem? You know, maybe they may not be on drugs or things like that, but they may have behaviors of addiction. How would someone know if they have that problem?
If it's affecting your lifestyle, if it's affecting your life, your relationships, your work, your health, and you can't stop whatever it is you're doing, then it's time to seek some help.
Okay, that's fair. We're halfway through 2021. What are you seeing this year as far as impact from the opioid crisis?
Um, I'm not seeing a change from last year.
Mm.
So last year we saw a huge rise in overdose fatalities, and we saw a 45% rise from the year before. And this year is no different. So far, it's no different at all. It's about the same.
Wow. W- People that are facing addiction, what type of resources would you recommend for our listeners out there?
Mhm. So, first one, very easy. If you do have computer access, something called findtreatment.gov, and you can go on that and look and see what kind of treatment you are seeking. And they listed by zip code, by types of addiction, etc., and what you're looking for. So that's easy. Adam H. here locally also has, you can call their number. The other is NetCare. Again, it's a crisis center, and they can help you with evaluation and then connecting you to treatment. Either one of the public health departments, Franklin County or Columbus Public Health Departments, also can help.
I know you said you haven't noticed a change from last year to this year with the opioid crisis. However, do you see any light at the end of the tunnel during this dark season?
Sure. I think everyone has to have hope, because without hope, there's no motivation to change. So I think there's always hope, and I think you always need to hold out some hope, um, especially with programs like this, putting out into the public, helping people become aware of the issue, broadcasting, where they can go for help. I think these are all things that show hope. Um, and eventually, with that hope, with that motivation for change, we will see a decrease, hopefully, in the future. Maybe not this year, hopefully next year.
Right. What are some of the other initiatives your office is working on to address the health and wellness of Central Ohio?
Sure. We have two grants, one from Franklin County Public Health, and we're the subgrantee, and they got that from the CDC. And that one is to hire a special investigator, who actually connects with the families and does interviews with the families to give them more information, number one, give them resources in case there are other folks there who have addiction problems, and also to get us more information on the issue here in Franklin County. We have another position that's there to get data. Without data, there's really change is difficult. And then in terms of suicides, we also got another grant from the Ohio Suicide Prevention Coalition to hire a specialist looking at suicide, talking with the families, doing interviews with the families, getting resources out in order to see what's going on here in Franklin County in terms of suicide, and see if we can help prevent suicides in the future. And then we run what's called fatality reviews, where we look at in depth some of those folks who have died of overdoses, suicides, and domestic violence.
Before we wrap up, is there any other additional information you would like to share with our viewers and listeners out there?
No, again, I'm grateful for this opportunity, and I'm grateful that you are highlighting this issue on your program, and that people can become aware of the resources that are out there.
Absolutely. From Franklin County Coroner, Dr. Anahi Ortiz, thank you so much for your time and sharing this information on Our in the Community.
Sure. Thank
Have
you.
have a good one.
Bye.